Hello class, my name is Steve Whitlock. I'm one of your first aid and EMT instructors, and today I'd like to give you a little presentation about heart attacks, how to recognize them, how to respond to them. This is an important subject because in today's day and age, heart disease is still the #1 killer of adults in the United States. And the more you know about this entity, the better off your patient will have of surviving. So first let's talk about how a heart attack usually occurs. Well, it starts off with the blood vessels that actually feed oxygenated blood to the heart. Now the heart is a hollow organ and it pumps blood through each one of its chambers, but that blood does not actually feed oxygen to the heart muscle itself. The heart muscle gets its oxygen from the coronary arteries that surround the outer surface of the heart. And if you can see in the diagram that at some point a plaque may build up on the inside of the coronary artery, and that plaque in itself can limit blood flow into the artery, minimizing the amount of oxygen that gets to that particular area of the heart. But over time, that plaque actually causes damage to the arterial wall itself. The components of that plaque can infiltrate inside the wall and create inflammatory changes that not only causes the opening of the vessel to swell up and narrow, but also causes weakening of the arterial wall as well. And at some point, that arterial wall, the inner surface of the wall, can rupture under pressure, just much like just scraping your knee on the sidewalk. And when that wall ruptures, a thrombus or a huge blood clot can form to try to patch up the damage. Now, a small clot can form or a big clot can form, but if the clot forms big enough where it blocks off the entire artery, well, that thrombus is going to block off or occlude blood flow to whatever part of the heart that artery is meant to feed. And over time, that deprived heart muscle becomes damaged or ischemic, and it will continue to be damaged and cells will continue to die in a process called infarction, which is your true heart attack. The goal in medicine is to reestablish that blood flow as quickly as possible. So as first aid providers, and especially as emergency medical technicians, it's most important to recognize the most common signs and symptoms of a possible heart attack. And one of the most common signs or symptoms I should say, of a heart attack that we associate with is chest pain. Now, many people can experience chest pain in different ways, describe it as an aching, a sharp pain, a dull pain. There really is no one textbook description of the discomfort one may feel in their chest. It also may be accompanied by shortness of breath, which would make sense if the heart's not pumping effectively and oxygen's not getting to the organs effectively. You're going to have a sensation of needing to get more oxygen into the body. It's not uncommon for someone to show an immense amount of sweating, or what we call diaphoresis. There are times when this may be the only sign of a heart attack with no pain, in which case we call it a silent MI. Dizziness is not uncommon if circulation to the brain is impaired. Nausea, vomiting, sometimes vomiting without a sense of nausea can be very concerning. And last but not least, the most serious sign or symptom of a heart attack is sudden death, which we otherwise call cardiac arrest, which is the #1 killer of adults in the United States. So if one's not sure if a person is actually having a heart attack or not, let's go back and look at the risk factors of the situations that may make one more prone to having this whole disease process take place. First thing I'd like to talk about is the #1 preventable cause of heart attacks, which is cigarette smoking. Nicotine in cigarette smoke or tobacco has been shown to narrow and constrict arteries. It also causes cellular damage to the inside of the artery, or what we call the lumen. Hypertension is a name for long-term uncontrolled high blood pressure. And over time, when blood pressure is elevated, it can cause damage to the arterial walls, setting it up for rupture and plaque formation and thrombus and sudden occlusion. Obesity or high body mass index has long been associated with onset of heart attacks. Also, having a poor cholesterol profile. Now, not necessarily high cholesterol, because there is good cholesterol and bad cholesterol, but the goal in life is to have your good cholesterol high and your bad cholesterol low. If it's the opposite way around, cholesterol can deposit fatty material on the inside of the wall of the artery, which can lead to all these inflammatory changes that we talked about. Now, I always say you can pick your friends, but you cannot pick your family. Genetics plays a big role in the onset of heart disease. That's not to say that if your grandfather died of a heart attack at 88 years old, that you have an automatic death sentence. If grandfather made it to 88, he was probably doing something right. However, if you're in your mid-30s and your father died at 40 of a heart attack, you have a brother in the late 30s who has certain heart-related illnesses, this is something that you should definitely take seriously. And last but not least, having a previous history of diabetes raises your risk of not only having a heart attack, but more complications from heart attack as well. Diabetes is a whole subject in itself, but ultimately it can cause inflammatory changes, deposition of fatty deposits, poor circulation in areas where organs need oxygenated blood the most. It's just a very horrible disease and probably a very underappreciated disease in our time. So if you suspect an individual is indeed having a heart attack, what can you do for this person? Well, for one thing, have them limit any physical activity. Don't have them walk it off. Don't have them exercise. The more physical activity they engage in, the more they're going to demand for oxygen with the limited ability to deliver oxygen to their heart. Any suspicion of a heart attack, call 911. Do not drive the patient privately. Do not call an Uber. Not every hospital has the optimum resources to treat heart attack victims. By engaging in the 911 system, not only can you get treatment initiated quicker, but you can also have resources to the most appropriate facility to give this person the best chance of survival. If you have a first aid kit and an AED, bring it or have somebody bring it in proximation to this patient. Now, you don't put an AED on a person who is awake and breathing, but as we said, one of the complications of heart disease is sudden cardiac death, so we want to have that there as close as possible, just in case the worst case scenario should occur. If there are no contraindications, aspirin can be a life-saving drug. It is obtained in many first aid kits, and it works by pretty much inhibiting clot formation, which can basically change this situation from a non-life-threatening event, from a life-threatening event to a non-life-threatening event, to which this person may have a complete recovery from. Although it's not common anymore, some patients are prescribed a medication called nitroglycerin, which they take when they experience chest pains. And nitroglycerin is designed to open up blood vessels and enhance blood delivery to a compromised heart. Again, you may not see this often because the prescriptions for it are not as common as they used to be. And first and foremost, continually monitor the patient, continually keep an eye on them. If you are trained to and prepared to, think about having to do CPR if this person's condition worsens. And just to show you what the ultimate goal in treatment of this patient is to be able to re-establish blood flow through that artery in a reasonable amount of time. And the optimal way of doing this is what's called balloon angioplasty, where the cardiologist will go in with a catheter under an X-ray machine, basically, thread that catheter through the circulatory system, thread it through the site where the plaque has built up, and open up that plaque with a fiber optic cable, which expands a balloon and basically squishes that plaque to the side, leaving that artery open and patent and able to deliver oxygen again. It is also reinforced with a little metal spring called a stent, and this is the most effective way to reestablish blood flow in that heart. The caveat being it has to be done within a certain amount of time before permanent heart damage occurs. That's why we want to recognize all these factors and employ them as quickly as possible. I thank you for your time and attention, and hopefully this has been a good presentation for you.